Or if they ask you, do you have a cat? If you have any animals, that's not typically on the sheet when it comes to clinical signs. And unless you're a veterinarian or you know about diseases in animals, that's really very unlikely. So most cases are not diagnosed unless, unless the individual dies and they made you a culture and then they discover that it could have been psittacosis. So what type of people are most likely to die from psittacosis? Who? Oh, thank you. All right, all I heard is so old and young. So these are immunosuppressed individuals, and then they would die from this bacterial agent. All right, any question about psittacosis? So what are the important things to remember about this disease? Splenomegaly and hepatomegaly. What else?
Green diarrhea.
Lime green, not just green, lime green. Lime green. Lime green diarrhea. What else?
It's zoonotic.
Very good. It's a zoonotic disease and it is reportable. It's important to know the etiology. So Chlamydophila psittaci used to be called chlamydia, but now it's called Chlamydophila. And that's it. And really how to diagnose and treat. So diagnosis is really easy. So you do isolation, and what is the drug of choice? Doxycycline for 45 days. If you know that, you have gotten those questions on the exam and on the NAVLE correct, because that's really the most important things to remember. What the disease looks like, how you diagnose it, and how you treat it, and keep it moving. All right, so the next bacterial disease is Mycobacterium. There are different subspecies that we see in birds. So Mycobacterium avium, genevense, tuberculosis, and bovis are all the different types that you can see in birds. They all present the same, but it's important that you have those on your radar when you have a bird. So this disease is not anything different than in other species. It's weakly gram-positive, and it is specifically acid-fast. So we use a Ziehl-Neelsen stain histologically to diagnose it. And can anybody give me another acid-fast bacteria?
Nocardia.
Nocardia, very good. What else? Actinomyces. Yes. So, but Mycobacterium is the one that really stands out, and you want to make sure you do an acid-fast stain. Obviously, that's histologically. So, Mycobacterium can look like a lot of different things. So, in people, in goats, in bovine, it typically presents with a multinodular appearance. So we can see that in the lungs, in the liver, in the spleen, in the GI tract. So this is the liver, and you can see you have multiple nodular white areas. These are the heart. This is a cross-section of a spleen with Mycobacterium. And this is the intestinal area. We're looking at the mucosal lining. It's multinodular. And this is the heart of a bird with Mycobacterium. What kind of inflammation do we see with Mycobacterium? Is it suppurative inflammation? Is it lymphocytic? Is it what? Granulomatous, right. So remember when we talked about tuberculosis in pathology, you see these multiple nodules and they're all macrophage based because they're all granulomatous. So the same thing occurs in our avian species. This is a particular unusual presentation of Mycobacterium. As you can see, you have enlargement of this area and it's multinodular. So I wouldn't even think of Mycobacterium if I looked at this. I would think of some sort of bacterial infection affecting the birds. What bacteria causes conjunctivitis in birds that Dr. Goran taught you. Did he teach you conjunctivitis or? Okay.
What caused conjunctivitis?
Was it Brent? Oh, when's your small animal test?
Tomorrow.
No wonder you're like glassy-eyed. I get it. No problem. So diseases like Pasteurella multocida can give you that. And a whole list of others. I think we talked about fowl cholera. Does that sound vaguely familiar?
Yeah.
I know that's not in a dog or cat, but yes, I understand. This is another case of Mycobacterium. So we have the heart right here, and this is the liver, and you see multinodular regions throughout. And this is showing you a histologic appearance of Mycobacterium. These are multiple sort of clusters of macrophages, and we did an acid-fast stain and a bright pink appearance. So pretty. So clinical science